81. Which finding indicates cardiogenic shock in a post-MI patient? A. Hypertension. B. Tachycardia. C. Oliguria. D. Warm skin. Answer: C. Oliguria. Rationale: oliguria, low urine output, indicates cardiogenic shock post-MI due to poor renal perfusion from pump failure. Hypertension and warm skin are absent, and tachycardia is present, but less specific. C is correct. 82. Which lifestyle factor increases MI risk by causing endothelial dysfunction? A. High-fiber diet. B. Smoking. C. Moderate exercise. D. Low sodium intake. Answer: B. Smoking. Rationale: smoking causes endothelial dysfunction by damaging vessel linings, promoting atherosclerosis and MI risk. High-fiber diets, exercise, and low sodium are protective. B is correct. 83. A patient with suspected MI reports dizziness. This is likely due to A. Hypoglycemia. B. Decreased cardiac output. C. Hyperventilation. D. Medication side effect. Answer: B. Decreased cardiac output. Rationale: dizziness in MI results from decreased cardiac output, reducing cerebral perfusion due to ischemia. Hypoglycemia, hyperventilation, and meds are less likely in this acute context. B is correct. 84. Which EKG change in leads V1, V2 suggests a septal MI? A. ST elevation. B. ST depression. C. T-wave inversion. D. Wide QRS. Answer: A. ST elevation. Rationale: ST elevation in V1, V2 indicates a septal MI, often from LAD occlusion affecting the septum. ST depression is reciprocal, T-wave inversion is later, and wide QRS is unrelated. A is correct. 85. What is the significance of a normal troponin level 12 hours post-symptoms? A. Rules out MI. B. Confirms stable angina. C. Indicates early MI. D. Suggests pericarditis. Answer: A. Rules out MI. Rationale: a normal troponin level 12 hours after symptom onset rules out MI, as it should rise within 3 to 12 hours if necrosis occurs. Stable angina, early MI, and pericarditis don't fit this timeline. A is correct. 86. Which medication is given sublingually for acute MI pain relief? A. Aspirin. B. Nitroglycerin. C. Morphine. D. Metoprolol. Answer: B. Nitroglycerin. Rationale: nitroglycerin is given sublingually for rapid pain relief in acute MI by dilating vessels. Aspirin is chewed, morphine is for, and metoprolol is oral for rate control, not acute pain. B is correct. 87. Which MI complication is most likely 3 to 7 days post-event? A. Ventricular rupture. B. Pericarditis. C. Cardiogenic shock. D. Ventricular tachycardia. Answer: B. Pericarditis. Rationale: pericarditis typically occurs 3 to 7 days post-MI due to inflammation from infarcted tissue. Rupture and tachycardia are earlier, and shock is acute or persistent, not time-specific. B is correct. 88. What is a key dietary recommendation to prevent MI? A. Increase trans fats. B. Reduce omega-3 intake. C. Increase fiber intake. D. High sodium diet. Answer: C. Increase fiber intake. Rationale: increasing fiber intake lowers cholesterol and MI risk by reducing atherosclerosis. Trans fats and sodium increase risk, and omega-3s are beneficial, not harmful. C is correct. 89. What does reciprocal ST depression in inferior leads suggest in MI? A. Anterior wall MI. B. Posterior wall MI. C. Lateral wall MI. D. Inferior wall MI. Answer: B. Posterior wall MI. Rationale: reciprocal ST depression in inferior leads 2, 3, AVF suggests a posterior wall MI, often from circumflex occlusion, as anterior ST elevation reflects posteriorly. Other options don't match this pattern. B is correct. 90. What is the result of prolonged myocardial ischemia in MI? A. Reversible injury. B. Myocardial necrosis. C. Increased contractility. D. Reduced inflammation. Answer: B. Myocardial necrosis. Rationale: prolonged ischemia in MI leads to myocardial necrosis due to irreversible cell death from oxygen lack. Injury is reversible only briefly, contractility decreases, and inflammation increases. B is correct. 91. Which anticoagulant is used in MI to prevent further clotting? A. Clopidogrel. B. Heparin. C. Alteplase. D. Aspirin. Answer: B. Heparin. Rationale: heparin prevents further clotting in MI by inhibiting thrombin. Clopidogrel and aspirin are antiplatelets, and alteplase dissolves existing clots, not preventing new ones. B is correct. 92. A patient with MI reports back pain. This is classified as A. Musculoskeletal pain. B. Referred pain. C. Psychosomatic pain. D. Drug reaction. Answer: B. Referred pain. Rationale: back pain in MI is referred pain due to shared nerve pathways with the heart, common in atypical presentations. It's not musculoskeletal, psychosomatic, or drug-related in this context. B is correct. 93. Which diagnostic tool is used to assess MI-related heart failure? A. Chest X-ray. B. Echocardiogram. C. CT angiography. D. Stress test. Answer: B. Echocardiogram. Rationale: echocardiogram assesses heart failure post-MI by evaluating ejection fraction and wall motion. X-ray shows pulmonary edema, CT identifies vessels, and stress tests are contraindicated acutely. B is correct. 94. What is the time goal for aspirin administration in acute MI? A. Within 10 minutes. B. Within 1 hour. C. Within 6 hours. D. Within 24 hours. Answer: A. Within 10 minutes. Rationale: aspirin should be given within 10 minutes of MI suspicion to inhibit platelet aggregation and improve outcomes. Delays reduce efficacy. A is correct. 95. Which MI complication is associated with a holosystolic murmur? A. Pericarditis. B. Ventricular septal rupture. C. Heart failure. D. Aneurysm. Answer: B. Ventricular septal rupture. Rationale: a holosystolic murmur post-MI indicates ventricular septal rupture, causing left-to-right shunting. Pericarditis has a rub, heart failure has gallops, and aneurysms are silent. B is correct. 96. Which activity should be avoided to prevent MI? A. Walking 30-minute daily. B. Smoking daily. C. Eating fruits daily. D. Stress reduction. Answer: B. Smoking daily. Rationale: smoking daily increases MI risk by damaging vessels and promoting clots. Walking, fruits, and stress reduction are protective. B is correct. 97. What physical exam finding is common in acute MI? A. Bradycardia. B. Tachycardia. C. Hyperthermia. D. Dry skin. Answer: B. Tachycardia. Rationale: tachycardia is common in acute MI due to sympathetic activation from pain and ischemia. Bradycardia may occur in inferior MI, but tachycardia is more typical. Hyperthermia and dry skin are unrelated. B is correct. 98. What is the role of clopidogrel in MI management? A. Dissolves clots. B. Prevents platelet aggregation. C. Reduces BP. D. Increases oxygen supply. Answer: B. Prevents platelet aggregation. Rationale: clopidogrel prevents platelet aggregation, reducing thrombus growth in MI. It doesn't dissolve clots, lower BP, or increase oxygen. B is correct. 99. Which risk factor for MI is linked to chronic inflammation? A. Obesity. B. Smoking. C. Hypertension. D. Diabetes mellitus. Answer: A. Obesity. Rationale: obesity increases MI risk via chronic inflammation, promoting atherosclerosis. Smoking, hypertension, and diabetes contribute differently, with inflammation less central. A is correct. 100. What EKG finding suggests reperfusion after PCI and MI? A. Persistent ST elevation. B. Resolution of ST elevation. C. New Q waves. D. Widened QRS. Answer. B. Resolution of ST elevation. Rationale. Resolution of ST elevation post-PCI indicates successful reperfusion, restoring blood flow. Persistent elevation, Q waves, and widened QRS suggest failure or damage, not success. B is correct. 101. What is the primary metabolic consequence of MI? A. Increased glucose uptake. B. Lactic acid buildup. C. Enhanced ADP synthesis. D. Reduced lipid use. Answer. B. Lactic acid buildup. Rationale. MI causes oxygen deprivation, shifting to anaerobic metabolism, which produces lactic acid buildup due to inefficient energy production. Glucose uptake decreases, ADP synthesis drops, and lipid use is secondary. B is correct. 102. Which condition increases MI risk by raising myocardial oxygen demand? A. Anemia. B. Hypertension. C. Hypothyroidism. D. Hyperlipidemia. Answer. B. Hypertension. Rationale. Hypertension increases MI risk by raising myocardial oxygen demand through elevated afterload. Anemia reduces oxygen supply, hypothyroidism slows metabolism, and hyperlipidemia affects plaque, not demand directly. B is correct. 103. A patient with MI presents with pallor. This is due to A. Fever. B. Sympathetic activation. C. Dehydration. D. Allergic reaction. Answer. B. Sympathetic activation. Rationale. Pallor in MI results from sympathetic activation, causing vasoconstriction and reduced skin perfusion due to pain and stress. Fever, dehydration, and allergies are unrelated to this acute presentation. B is correct. 104. Which EKG finding indicates an evolving MI hours after onset? A. ST elevation. B. T wave inversion. C. Q waves. D. Peaked T waves. Answer. B. T wave inversion. Rationale. T wave inversion hours after MI onset indicates an evolving infarction as ischemia progresses beyond the acute phase, ST elevation, but before necrosis fully sets, Q waves. Peaked T waves suggest hyperkalemia. B is correct. 105. What does a positive troponin test confirm in MI? A. Coronary spasm. B. Myocardial necrosis. C. Stable angina. D. Pericardial inflammation. Answer. B. Myocardial necrosis. Rationale. A positive troponin test confirms myocardial necrosis in MI as it's released from damaged heart muscle. Spasm, angina, and pericarditis don't elevate troponin significantly. B is correct. 106. Which intervention is the gold standard for STEMI treatment? A. Thrombolytics. B. PCI. C. Beta blockers. D. Oxygen therapy. Answer. B. PCI. Rationale. Percutaneous coronary intervention, PCI, is the gold standard for STEMI, directly restoring blood flow. Thrombolytics are secondary, beta blockers manage demand, and oxygen is supportive. B is correct. 107. Which MI complication is most likely to occur weeks after the event? A. Cardiogenic shock. B. Ventricular aneurysm. C. Ventricular rupture. D. Arrhythmias. Answer. B. Ventricular aneurysm. Rationale. Ventricular aneurysm develops weeks post-MI as scar tissue weakens the wall. Shock and rupture are early, and arrhythmias are acute or persistent, not typically delayed. B is correct. 108. What is a primary prevention strategy for MI in high-risk patients? A. Daily aspirin. B. Annual EKG. C. Stress testing. D. High-fat diet. Answer. A. Daily aspirin. Rationale. Daily low-dose aspirin prevents MI in high-risk patients by reducing platelet aggregation. EKG and stress testing are diagnostic, and a high-fat diet increases risk. A is correct. 109. What does ST elevation in leads V3, V4 suggest in MI? A. Inferior wall MI. B. Anterior wall MI. C. Posterior wall MI. D. Lateral wall MI. Answer. B. Anterior wall MI. Rationale. ST elevation in V3, V4 indicates an anterior wall MI, typically from LAD occlusion. Inferior, 2, 3, AVF. Posterior, V7, V9, and lateral, I, AVL, V5, V6. MIs affect different leads. B is correct. 110. What causes the chest pain in MI? A. Plaque buildup. B. Myocardial ischemia. C. Coronary spasm. D. Inflammation. Answer. B. Myocardial ischemia. Rationale. Chest pain in MI is caused by myocardial ischemia from reduced blood flow, triggering pain receptors. Plaque sets the stage. Spasms are transient, and inflammation is secondary. B is correct. 111. Which medication reduces mortality post-MI? A. Nitroglycerin. B. Beta blockers. C. Morphine. D. Heparin. Answer. B. Beta blockers. Rationale. Beta blockers reduce mortality post-MI by lowering oxygen demand and preventing arrhythmias. Nitroglycerin and morphine manage symptoms, and heparin prevents clots, but B has the strongest evidence for survival. B is correct. 112. A patient with MI reports arm pain. This is an example of A. Referred pain. B. Musculoskeletal strain. C. Anxiety symptom. D. Drug side effect. Answer. A. Referred pain. Rationale. Arm pain in MI is referred pain due to shared nerve pathways with the heart, a classic symptom. It's not musculoskeletal, anxiety-driven, or drug-related in this context. A is correct. 113. Which imaging is used to detect MI-related coronary artery disease? A. Echocardiogram. B. Coronary angiography. C. Chest X-ray. D. MRI. Answer. B. Coronary angiography. Rationale. Coronary angiography directly visualizes coronary artery disease in MI, identifying blockages. Echocardiogram assesses function. X-ray is nonspecific, and MRI is less acute. B is correct. 114. What is the maximum benefit time for thrombolytics in MI? A. 3 hours. B. 6 hours. C. 12 hours. D. 24 hours. Answer. B. 6 hours. Rationale. Thrombolytics provide maximum benefit within 6 hours of MI onset, with efficacy peaking earlier, e.g., 3 hours, but still useful up to 6. Beyond 12 hours, benefit drops significantly. B is correct. 115. Which MI complication leads to sudden hemodynamic collapse? A. Pericarditis. B. Ventricular rupture. C. Heart failure. D. Arrhythmias. Answer. B. Ventricular rupture. Rationale. Ventricular rupture causes sudden hemodynamic collapse post-MI due to cardiac tamponade or massive bleeding. Pericarditis, heart failure, and arrhythmias don't typically cause this acutely. B is correct. 116. Which nutrient should be increased to prevent MI? A. Saturated fat. B. Omega-3 fatty acids. C. Sodium. D. Trans fat. Answer. B. Omega-3 fatty acids. Rationale. Omega-3 fatty acids reduce MI risk by lowering triglycerides and inflammation. Saturated and trans fats increase risk, and sodium affects BP, not directly prevention. B is correct. 117. What is a key assessment finding in acute MI? A. Hypotension. B. Fever. C. Bradycardia. D. Warm extremities. Answer. A. Hypotension. Rationale. Hypotension is a key finding in acute MI, reflecting reduced cardiac output or shock. Fever is rare, bradycardia may occur in inferior MI, and warm extremities are absent. A is correct. 118. What is the purpose of morphine in MI management? A. Prevent clot formation. B. Relieve pain and anxiety. C. Increase BP. D. Improve contractility. Answer. B. Relieve pain and anxiety. Rationale. Morphine relieves pain and anxiety in MI, reducing oxygen demand via vasodilation. It doesn't prevent clots, raise BP, or improve contractility. B is correct. 119. Which risk factor for MI is linked to oxidative stress? A. Smoking. B. Obesity. C. Hypertension. D. Sedentary lifestyle. Answer. A. Smoking. Rationale. Smoking increases MI risk via oxidative stress, damaging vessels and promoting atherosclerosis. Obesity, hypertension, and sedentary lifestyle have different mechanisms. A is correct. 120. What EKG change indicates successful thrombolytic therapy in MI? A. Persistent ST elevation. B. ST segment normalization. C. New Q waves. D. T wave peaking. Answer. B. ST segment normalization. Rationale. ST segment normalization POS